Okay, with the permission of the Chair, I now call the second speaker of the proposition, Umair Zafar Malek.
Ladies and gentlemen, I'm going to talk about 5 things here today. First of all, I'll talk about the need of this policy and the concession that they've made on team opposition. Secondly, I'll talk about burdening the government or overburdening the government. Thirdly, the right to choose that team opposition seems to stand for, and what team opposition stands for, and what we propose in response to that. Fourthly, the issue of sustainability and should private healthcare be banned as it is a booming industry like insurance companies. And finally, the issue of our cost-benefit analysis for the lay, which is my positive case, how it will in the long term improve the state of affairs for an average American citizen. Right, so starting off with the need, ladies and gentlemen. This side of the house came here and told us that there is no need for the state to intervene. However, in direct contradiction to that, they came up with an alternative policy as well, clearly agreeing that there is probably something wrong with the status quo. When they come here and they say, when they provide a half-baked policy where they say that we'll put a cut off of $30,000 and above that people can choose, below that, yes, there lies an issue. Below that, yes, people do not have healthcare. Below that, yes, it is the responsibility of the state to provide those people with healthcare. We believe that they have essentially conceded that there exists a need. There is something wrong with the status quo, and that's why they've come up with a half-baked policy. And the half-baked nature of that policy is also something that I discussed in detail. They've never really mentioned where they will get the money from for that policy of theirs. How will the state make sure that all those who earn less than $30,000 a year will be treated on state funds? They've never really shown where that money will come from. So the relative absence of policy on that side of the house is also evident. Secondly, ladies and gentlemen, the right to choose. Now we believe on team proposition, we stand for the right to life. We believe that basic healthcare is a necessity. It's something that the government must provide to even to the last 1% of the American, to the poorest of the poor, ladies and gentlemen. Now while they stand for the right to choose, sit down ma'am, while they stand for the right to choose of the elitist, of the top 15, 20, 30%, we stand for the bottom 5% as well. We believe that this is important, that even those who do not earn as much as is required by the healthcare system should also be provided healthcare by the state. I'll take you on that in a minute. And they have sort of principally conceded to that as well, when they have said that yes, the state should provide healthcare to those who earn less than 30,000. So there is not only a concession to the need, there is also a principal concession involved. Do you disagree, ma'am?
Sir, you said that you stand for the bottom 5% of the spectrum. So what about the 95% of the spectrum whose quality of healthcare will be compromised because of this 5%? Whose quality will not even be met under your model?
Yeah, ma'am. I'll come to, and this I'll address when I discuss the issue of burdening the government, how we're actually taking the burden away from those who do not deserve it, and how the government will do a better job at that will be addressed there. But about the issue of right to choose, we believe that it is important that every person in the United States of America has access to basic healthcare, has access to his right to life, ladies and gentlemen. We see people who are dying because they do not have access to healthcare. We believe that in this situation, the right to life, the right to basic healthcare trumps the right to choose different qualities of healthcare. And those people, even in the status quo, people go to Cuba, people go to the Middle East, people come to those countries where surgeries and procedures are cheaper. And these elite people continue to have the choice to go abroad, to go wherever, since they have all the money at their disposal to do whatever they want. But for their interest, for their right to choose, we will not trump the right to basic healthcare and the right to life. Right. Now thirdly, the burden on government, the burden on government, and will the government be able to do justice to this role? We believe that in the status quo, there are waiting lists in government hospitals. Why? Because the government does not have enough resources. The government does not have enough physicians, enough hospitals, does not have the control of the healthcare facilities. In this situation, since the private healthcare system has failed shamefully and miserably, people are forced to resort to these public alternatives, and in that situation, these alternatives cannot meet the needs. Why? Because they do not being given that responsibility. They're not built to do that. In our model, what we're doing is that by through an increase in taxation and through engaging these charity organizations, what we're essentially doing is that we're burdening the government with the responsibility and providing it with the resources as well. Sit down, sir. And when the government has the resources, when the government takes control of the entire healthcare system, when the government has everything at its disposal, that is when, sit down, ma'am, that is when the government will be able to take care of the people, and that is when the quality of healthcare will not be affected, and that is when the waiting lists will cease to exist. Yes, ma'am.
Sir, previously you mentioned you're going to take the burden away from those who don't deserve it. You're putting this burden on charity organizations. Is that how strong your policy is?
Yes, ma'am, exactly. We're putting the burden on those organizations, we're engaging them. Now, these are people who are willing to donate money. These are people who are willing to help the Americans. We're just engaging them. This is a very good, positive avenue where the government, and by the way, their policy does not have anything to say to that. They do not have any avenue for creating money unless they print more money or something. But in our model, what we're essentially saying is that, when the government is burdened with responsibility and is also providing resources through increased taxation, through engagement of these charity organizations, we believe the government will be able to do a decent job. And right now it's not doing it because it's not built to do that. And it's only because of the failure of the private healthcare system that the government is forced into such a position. Fourthly, ladies and gentlemen, the issue of sustainability, and should private healthcare organizations, since they're a booming industry, be banned. We believe that sustainability should not be an issue because, as we've already told you in our first speech, that we're making it a part of mandatory government spending. And no matter how tough the going gets, mandatory government spending is never compromised upon. And in that situation, we're making it a basic human. We're recognizing access to good quality healthcare as a basic human right. And through that, we're making it mandatory government spending, which will never be compromised upon. We're making sure that no matter how tough the going gets, American people have access to healthcare versus the status quo where more than 50% do not have access to quality healthcare, are over-medicated, pay unnecessarily for investigations that are never needed in the first place. We're correcting the problem that they agree exists. They never really came up with a policy either. Finally, the issue of private healthcare, should these organizations be banned? We believe that yes, in the interest of the lay American, in the interest of those who are being over-medicated, in the interest of those who are overpaying for investigations that are never needed, in the interest of those who do not have quality access to quality healthcare, we believe that yes, a booming industry should be banned for their right to basic good quality healthcare and their right to life. The issue of a cost-benefit analysis for the lay American. Ladies and gentlemen, we believe that right now the Americans pay insurance companies. All their lives they pay these insurance companies. And whenever they require a medical procedure, these insurance companies back out on different reasons and pretexts. Preconditions being the most common. In that situation, what basically happens is that the Americans are already paying. The only difference is that they're not even getting the healthcare that they're paying for. In our model, what we're essentially saying is that we're increasing taxation, but we'll make sure that the Americans also have access to healthcare. When we increase taxation, we'll make sure that whatever they're paying for, they also get that. Instead of the current system where they continue to pay all their lives and do not get anything in return. Finally, ladies and gentlemen, an additional benefit of this policy, in the status quo, these profit-driven tertiary care hospitals overwork and overstretch the working hours of these physicians. So, residents in the US have 120 hours of working every week. In that model, what essentially happens is that, there's room for job creation, but people are not being employed. Why? Because they will have to be paid. In our model, when we employ more people, that will also lead to job creation, and that is also an additional benefit of this policy. And in the long run, a healthier population that can contribute more towards the economy, a healthier population that can be relied upon for work is, in the long run, more beneficial than a sick, over-medicated, obese American population. So in summary, what have I told you today? First of all, I have told you that there is a need that they've considered to, and they've come up with a half-baked policy. Secondly, I have told you that the right to choose quality healthcare stays with these people who can go abroad, but we're willing to compromise that for an average American's right to life and basic health care. And finally, in the long run, for the American, he'll now get what he pays for. Thank you.
Speaker spoke for 8 minutes, 22 seconds.